This is a 14-year-old boy who lives in Illinois, came here to New Jersey in order to participate in a trip. And here he gets a seizure and he develops high fever. He gets admitted to the emergency room in the hospital, and all of a sudden he has the most severe form of brain infection. He has what we call a subdural empyema. He has got a subgaleal abscess, and he is in a very critical condition. Quickly, within a period of 15 minutes, this patient starts to develop weakness with a 14-year-old young boy and starts to be drowsy. And we get him scanned for his head, and we found this huge subdural empyema. And here comes his mom, here comes his dad, respectively, and he has to go to the operating room. As a matter of fact, they come to the hospital when I have him in the holding area just before getting into the operation room, because it's really a dire emergency and I couldn't wait for anyone. I talked briefly to both parents who had seen just a glimpse of their child, who is not the child that they know because he's very sleepy, he cannot respond to them calling his name, he's unable to move, and he really looks sick. He goes into the operating room, has quite significant brain surgery, comes out to the pediatric intensive care unit, and then 2 days later, this young man starts to get back to himself. And you could see the parents that you have seen in the holding area before taking him to the operating room, kind of riddled with worry and riddled with fear about their loved ones. And now, as he's waking up, as he's able to move his hands, and as he's able to wake up and respond to them, here you find this complete change in their condition. Then they refuse to go back to continue the treatment in Illinois because they think that the miracle happened here. But then after some time, it took about like 3 weeks or 4 weeks, and then after regaining almost everything, his consciousness, his movement, his ability to think, his ability to solve problems, he would still need more antibiotic treatment for about 6 weeks from the time of surgery, and he accepts, or they accept as well, him to be transferred to his home. I think this is just an example of how much you can influence the lives of families, influence the lives of a 14-year-old kid, whom if he hadn't been taken care of in the right timing, he probably would not have survived this severe brain infection.